So when does Fido need a supplement? Are they safe? Will they work? Who can you trust? We've covered topics and issues like that in the past. How do you know if your pet's going to be need a supplement? How do you know if it's going to be safe? How do you know if it's going to be effective? Today we're going to touch on things like antioxidants. We're going to touch on things like complications with the supplements and transitioning from no supplement to supplement new, or from supplement A to supplement B. And we're going to touch on how these supplements are going to affect and influence the aging process in our pets. So remember that supplements are kind of the Wild West. There's no regulations. They're not FDA products. And one of the complications and challenges is dealing with that fact that, we go to our best pharmacy, we get a prescription from the doctor, we've got all these guarantees that what's in the bottle is exactly what's on the label, and we've got all these guarantees that when the doc said it's going to fix your pneumonia, there's field trials, there's clinical tests, there's data in stacks in the FDA that says it's going to work. Is that true for our supplements? No, it's not. So we're going to address issues such as why we're using supplements in the first place. The three general classifications for why we're using supplements in the first place. We use supplements to address specific problems. We can use supplements to protect or enhance our general overall wellness. And we can use supplements on a preventative type basis. So from the standpoint of addressing specific problems, we can good remedies, good solutions for joint issues, arthritis, pain, etc. Behavioral issues from anxiety to even seizures can be influenced and improved dramatically with the use of non-prescription supplementation if administered intelligently and therapeutically. Organ diseases such as liver, kidney, heart, pancreas, the intestinal tract, all can be supported with supplements. Our general immune system can be supported with supplements. So why supplementation? Well, in overall wellness and in prevention, we live in a toxic environment. At least some of us are fortunate enough to be on the top of a mountain and breathing fresh air, and then in the countryside, living the life of Riley, so to speak. But most of us are in urban environments. We've got pollution. We've got chemicals on our lawn. We've got chemicals on our furniture. We've got chemicals in our environment. Do we need supplements to protect that? We're going to talk about antioxidants shortly. But yes, providing protection against those toxins and those negative influences in our environment is definitely something that we should be considering for our pets. From the standpoint of prevention, there are certain illnesses and conditions that an individual or a specific breed might be faced as a challenge. For example, Cavalier King Charles Spaniels are going to have a predisposed risk factors for a condition called cardiomyopathy. Can that be influenced or enhanced or prevented by certain supplements? We can look at those today and in the future. Certain breeds, giant breeds, Dobermans, the Great Danes and the like, are predisposed to atrial fibrillation and cardiomyopathy. Can that be prevented or assuaged? Yes, we can look at things like that. So the supplement conundrum we're going to look at here just briefly, because the issues that we face is that from the standpoint of quality control, it ranges from very good to very non-existent. From the standpoint of common problems that we experience, there can be contamination of bacteria, yeast, molds, toxins such as heavy metals, etc. Problems with incomplete labeling all plague this very important market. I want to touch base in a second here on common problems from the standpoint of the products themselves. We have choices of going to a human health food store and getting supplements from them. We have choices of going through a veterinary hospital and getting supplements for them. We have choices of going through a pet supply type product industry and getting products from them. All of those, to a certain degree, are physical locations. Now we have the internet, so you can get the same and more many times on the internet. How can you choose? We're going to look at certain factors of that in a second. But the problem is assuming that you want supplement X. This is a fatty acid supplement, omega-3 fatty acid supplement. You want an omega-3 fatty acid supplement. You go to Mother's, which is the local health food store around here. You go to your favorite health food store, and lo and behold, there is a plethora of omega-3s. And there may be a small doggy kitty section. There may not. Most of the time we go to the health food store, it's because we want product A, and they're only available across the board for people. The introduction of pet-specific product is relatively new to the industry, and many products that we need for our dogs and our cats are not available in veterinary formulated products. So we've stuck with the human side. If we get this product in a human type environment, there may not be dosages. We said we want dosages, right? And if the dosages are there, they're for people. And the take home from all of this is pets are not people, and cats are not small dogs. So the dosage for a person, if you try to extrapolate it down to a dog or, God forbid, a cat, the chances of being accurate is minimal. The dosages need to come from veterinary formulated products or directly from your veterinarian, and that will solve a lot of your problems. Skipping back up here to the significant differences in what I call disintegration, dissolution, and gastrointestinal absorption. You take pill A and you plop it into a person that's made for a person. Chances are it'll do what it's supposed to do. What it's supposed to do is dissolve in the intestinal tract, be absorbed. First of all, the pill is supposed to break down and some of them are so crumped up that they never really break down. It goes to the intestinal tract and gets pooped out. Bad. So it's supposed to break down, it's supposed to get dissolved into the stomach juices and then the intestinal juices, and then it's supposed to be absorbed. And if it's definitely made for people, it's definitely made for a person's gastrointestinal pH and dissolution factors, which are extremely different in dogs and cats. So just because it works super in a person doesn't mean it's going to work super in a dog or a kitty cat. And if there is a veterinary product available, you should favor those for sure. That's the short version. How do we know if they're good? Well, clinical trials are the gold standard. Clinical trials are the gold standard. But as far as supplements concerned, they're few in between. So social proof is a resource that we have. 20 years ago, we didn't have that. When it first came out, I was very suspicious. Now social proof, product reviews that you can get online. Most of us will check those. I would encourage you to check those because if you have one or two, it's hard to say. You got 75 and one person says that they gave their dog diarrhea and everybody else said it was just fine. Yeah, that's probably a pretty good product. So throwing out the outliers, I said it's terrible and I said it's really good, and seeing what's in the middle will give you really good information. It's up to us to be proactive in getting the good information that we need. There's a concept of veterinary formulated products for your dogs and for your cats because the labeling is going to be correct for dogs or cats, and you're not going to have to try to extrapolate it or guess or call somebody, call your veterinarian, call me, put a comment in a post like this that we'll see, and we can sort out your problems. But you can ensure that it's safe for dogs and cats, number one. At least you'll raise your high level of confidence way up there. The other factor in veterinary formulated is that many of these products will have multiple stuff in them, and we'll get that here in a second. The concept of pet-friendly overlaps with veterinary formulated. And the two combined are going to gravitate towards palatability. It's going to taste better. If this product comes from Mother's Market or your local health food store, the human industry doesn't really care what it tastes like. Because they're going to figure it's going to say take 3 capsules with an 8-ounce glass of water, and you chug down 3 capsules with your 8-ounce glass of water, and you go on throughout your day. No problem. We've been doing that for decades, right? When you send 3 capsules to your dog and you lay them down in the middle of the food bowl, it isn't going to happen, right? So you're either going to stuff them down your throat, you're going to hide them in cheese, you're going to hide them in peanut butter, you're going to do this or that, trying to get it into them. If they can smell it, if they can taste it, doesn't happen. So the veterinary formulated pet-friendly type products the manufacturers have attempted is the critical word, have attempted to make it flavorful, to make it tasty, make it go down easily. Now, you can give some cats peanut butter, and they'll drool and throw up and foam and go and hide in the closet for 3 weeks. But in general, if you give them a feline palatable product, a higher percentage of them are going to accept it and get it down. And compliance is the name of the game, because if pet A needs product B and they won't take it, it's not going to do anybody any good whatsoever except the manufacturer who's selling products. So I want to mention and touch on free radicals. Free radicals are molecules that are identified as creating problems. Think of a free radical as a molecule that's swimming around in the system at the cellular level, sometimes even inside the cells, but on an important surface, like the cell wall of a cell, or inside the cell, like on the surface of a mitochondria. Think of it as kind of an alien going around the manufacturing center of our body. This is our little free radical. And a very intact, happy cell wall surface that's the free radicals, it comes across this cell wall surface, and it attaches to that, and it rips off part of that cell wall surface. The cell is now damaged, and it's dead. And what happens when the cell dies? The body has to replace it. It's a stress. It creates all kinds of things. And there's a theory of aging called the free radical theory of aging, which is well validated many times nowadays. So that free radicals are a very big factor in damaging our body, damaging our pets' bodies, and accelerating the aging process. The free radicals have enemies, and the enemies are antioxidants. The antioxidants protect us from the free radicals by eliminating from the system before they can get out and damage our cell walls or our important body machinery. That's how free radicals work. So from the standpoint of where we can get antioxidants to protect ourselves, antioxidants come in various different flavors. Many vitamins are antioxidants. There's a list here that we can briefly review it. Some vitamins are excellent antioxidants and protect us from that oxidative, corrosive type process. Other antioxidants in the form of many amino acids, well, some amino acids, lysine, cysteine, and the alpha lipoic acid, and ALA, is one of the very potent and important antioxidants we have in our system that is possible to actually supplement on many occasions. Quality, quantity, and cost. Because it's a trade, many times we don't attempt to. What we need is good manufacturing practices to rely on. And many times that's impossible for us to figure out on our own. But the industry has provided two mechanisms that are independent outside certifications that allow us to have a high level of confidence without spending years and a lifetime worth of research. The National Animal Supplement Council is an outside third-party organization that any company can go to them, raise their right hand and say, we're going to abide by your rules, sign the documentation that they're going to abide by the rules, and they'll take their product, their supplement, and give it to the NASC, and the NASC will analyze it for what's in the label. They'll test it for what's in the label, and they'll say, yes, the pills in here match your label. And you and I take that for granted, but trust me, the majority of that sale is probably on less than 10% of the products that you can find. Certainly on less than 10% of the veterinary animal products that are out there. NASC is not a people thing, National Animal Supplement Council, but it's a seal of guarantee of what the pill is matches the label. The USP is a separate program, government supervised, that actually tests the product before the company puts it on the market. And it's very similar to the NASC, but the USP product certification does not necessarily refer to just veterinary products. You can have vitamin A from Mother's Market or their local health food market, and it could have a USP certification on it, which says what's in the package is on the label and it matches. And that's important. So, fun work. Is your pet on the supplement? Does your pet experience any side effects? Has he gotten better? Has he gotten worse? You're not sure? Type it out in the comments below. We can look at that. We can discuss that and see if you're having any problems. Love to participate in any type of issues that you might have. So fill out a comment below, and we can look at that as time and change goes on. Today, we've talked about supplements. Does your pet need them? How do you know? We've talked about the importance about antioxidants. We talked about complications and interactions that we have. Transitions. We haven't talked about transitions. We talked a little bit about aging. Aging is more to come in other issues that we've in other videos. They'll be in the links below. Briefly on transitions, how to move Fido or Fluffy to a new supplement. Remember that supplements, we don't take them for granted. We're using them for a reason. They're homeopathic to a certain extent. But remember that pharmacology started with herbs and teas and roots and berries that our ancestors developed and intelligently applied as their medicine for ages. The Eastern cultures use supplements and Eastern herbs and the like for ages. These are very potent products. The package label for my Bernese Mountain Dog might be 5 of these. Am I going to give him 5 tomorrow morning when my veterinarian, which is me, says Aura needs to take 5 of these twice a day? No, because it could upset her system. I'm going to gradually introduce them. So the concept of transition is very, very, very simple. I'm going to start out with about 25% of the target dose. The next plateau will be about 50%. The next plateau will be about 75%. The next plateau up to 100%. What do I mean by a plateau? Plateau is going to be days. What's important is that you know your dog. If your dog or your cat has a cast iron stomach and you can kind of give it anything, anytime whatsoever, the transition plateau might just be 3 days. If your kid, every time you give him something new, he gets gas, he gets diarrhea, he may even throw up, your transition plateau could be 10 days to 2 weeks. If your kid's somewhere in between, it's going to be somewhere in between. So going back up to this little formula here, if I've got a kid with a cast iron stomach, and I'm supposed to give 4 pills a day, I'm going to start out with 1 pill a day for about 3 days, 2 pills a day for 3 more the next 3 days, and etc. If I've got a kid that's very, very, very sensitive, I'm going to start out with 1 pill, and I might wait 2 weeks before I go up to 2 pills. There'll be links in the description to past videos that you can assemble and study on your own. An in-depth study on Dr. B's 8 acid tests to determine whether a supplement is safe, whether it's going to be effective, whether you should even consider purchasing or not.